Szeretettel köszöntünk mindenkit.
It's a pleasure to welcome everyone. Thank you very much for the invitation. We hope that we can give you useful information. In the first part of my presentation, I'd like to talk about life quality, and in the second part, about aquatherapy methods. We work at the Rehabilitation Clinic of the Semmelweis University. Central Hydrotherapy started its working with the small pool that you can see, and a new modern facility was built, and it was extended with a 25-meter pool. Thanks to that, we can give care to many more patients. In this new facility, we have an entirely barrier-free environment, and the quality of the rehabilitation care and the equipment itself has been much improved, and it can help increasing life quality. As for the concept of life quality, there's a WHO definition, and we have questionnaires with the specific versions for specific diseases. It depends on the person's position in life, influenced by the culture of its environment, their own goals, expectations. It's a broad concept. It includes the physical health, psychological state, social connections, personal belief, and their connection to their environment in broad terms. I was looking for life quality studies as part of my preparation for this presentation. There are not much, and none of them used the questionnaire set up by WHO. In Germany, there was a study of 466 persons with an average age of 44. And they used the 5-dimension questionnaire: mobility, pain, discomfort, anxiety, and activities of daily life. And as for the results, mobility, pain, discomfort, and everyday activity, 80 to 90% of those questioned signaled that they had problems, and more than 50% of participants did not report any difficulties in daily life activities. As for the VAS scale, their scores were significantly lower compared to the healthy population. In Serbia, there was another study with 45 persons who have been living with this disability on average for 50 years. The questionnaire asked about sociodemographic and clinical characteristics, and they used the SF36 questionnaire. The best scores were for mental health and social function. On the other hand, physical role taking and physical function had the lowest scores. As for the back depression scale, about 1/3 of the participants had depression, and their pain was significantly higher compared to the healthy population. As for the group tiredness test, 56% reported tiredness. As for low scores in mental and physical fields are associated with muscle weakness and more severe limitations of mobility, the use of walk assisting devices, tiredness, and depression. Tozza and Alf found weakness of the extremities, balance issues, which has an effect on feeling of self-worth and life quality. Another study was made in cooperation with United States, United Kingdom, and Australia. This measurement tool was earlier validated for the adult population, and in this study it was validated for children aged 0 to 7, and they saw that life quality was affected already in early childhood. And it was similar to the other age group, 8 to 18. Even in cases with less severe phenotypes, you can see the effects of the disease. As for rehabilitation, ensuring life quality is extremely important, which requires teamwork, taking into consideration the state of the person concerned. We provide aquatherapy. In our institute, we have a barrier-free environment, a safe, adapted form of therapy to assist our clients. And we use our tools adapted to the state of the patient, the best tools for them to get to the water, the safe transfer to the water, requires for the person to have the right mental state, the lack of fear from the water, and leaving the water must also be safe. Even the smallest wrong movement might destroy the effect of the therapy. Rehabilitation does not stop at the walls of the institute. It must continue at home and in the smaller and wider environment. It's important that they can take up activities they wish. If they want to go to swim, we must provide the right environment in their local swimming pool. And we consider the affected person as a partner. In our clinic, we have had a human kinesiology laboratory for 4 years. I'd like to talk about the examination of the spine, where we can assess the spine without touching, and we can follow the progression of the state, and it's void of harmful radiation. And it provides useful charts. You can follow the state of the patient, and it helps to make the patient more conscious of their progression. And it's a useful tool for the specialist, which supports the education of the patient. And I'd like to give the floor to my colleague. Thank you very much. My name is I'd like to ask Kornelia. I'd like to thank Kornelia Krausz for this introduction. My name is Eniko Katona. I'm a somatopedagogue and physiotherapist. We work as part of a team in this institute, and I'd like to emphasize that we have short and long-term rehabilitation goals in partnership with the clients. Kornelia talked about the concept of life quality. Life quality goals and rehabilitation goals do not always precisely cover each other. And we can see that in hydrotherapy, because patients say they would like to walk, manipulate objects speak, have the same cognitive function as before the disease. And in hydrotherapy, we have life quality goals such as relearning swimming, maybe participate in swimming competitions. Aquatherapy in this way is linked indirectly and supports indirectly life quality. We have already heard in previous presentations about the close link of independence and life quality. In many cases, in the water, the patient experiences liberation, movement without pain, or series of movements without pain. Let's see what are these movements that can help our adult patients to experience this. Well, aquatherapy methods are always based on neurophysiological foundations. It means that we believe the hydrodynamic, hydrostatic, and psychological effect mediated by the water from the peripheral nervous system to the central nervous system, and we experience it every day, that this complex stimulus is shown in the development of the coordination of our patients. It's important in the case of aquatherapies that it's not primarily based on water, but it's primarily based on grounded techniques adapted to the water. Let's look at our techniques. We make difference. I'm not going to enumerate everything, of course. These are techniques we use in adult rehabilitation. So there's a difference between active techniques such as Helibic method, which is the adult version of the Bobak technique. We have bed ragazzi technique, the ai chi, which is the water version of tai chi, or watsu relaxation or healing dance, which I like very much, based on dance choreography. We have active aquatherapy techniques. In this case, we use the hydrostatic, hydrodynamic environment of the water, which is a biomechanical force to stimulate the movement of the patient. The best temperature is 30 to 32 degrees because patients are active. In the case of aquatherapies, passive aquatherapies techniques, relaxation techniques, where patients float, where the therapist supports the patient, and there are a lot of movement impulses that the patient really receives. And of course, you don't have to support your own weight, which is key to the technique, in order for the patient to experience a relaxed state. And you can experience long movements, nice movements. And when this relaxed state, this happiness is linked to a series of movements for 45 minutes, it will support self-love of the patient, the self-acceptance. As was mentioned in the first presentation of the professor, she said, you have to accept this state. This is very harsh, but there are methods that can facilitate this. Well, there's some problem with my slide, but in any case, I'd like to talk about the Helibic method now, a bit more in detail. It was James Macmillan who developed this method in the 50s with the team of Bad Ragazzi. In the water, everyone is able to carry out independent movement. This buoyancy is always present in the water, and this is the force causing instability. This metacentric force influences whether you are more or less stable. You can see my colleague who is floating on the water, and I am supporting her at her heels. And you can see that she is floating, she is in balance. Adam has mentioned this important experience, the experience of floating, which is influenced by many factors actually. We have various tissues, muscle tissue, bone tissue, etc., which all have different specific weights, and the age also has an influence on the water content of our tissues, which influences the length of floating, and different forms and deformities also influence the way of floating. But talking about the metacentric force is the origin of the buoyancy and the gravity. Metacentric force is always present, even if you sink entirely under the surface of the water. If you look at the left and right picture, I asked my colleague to lift her hand. So we are talking about a couple of grams of weight, and you can say that her body rotates in the other sense. So the body will rotate against some axis if you lift some body part, and if you are unable to rebalance it, you will get a stress reaction. Another more important factor of the holic method is that we do not use any devices assisting floating, because we want our patient to go through a psychosensory motor process to gain sensory information about their body and be able to create stability. We have a 10-point program, psychological independence, rotation alongside different axes of the body, creating the individual swimming style. I've got few videos to illustrate these points. As for these 7 points, the order is not important. It is always adapted to the disability. The first point, the psychological preparation is important. It's important for the patient to experience what it feels like being in the water. You can sprinkle some water on their face or blowing bubbles. The first, the important thing about it is for them to arrive in the water. You can see here breathing control. I'm supporting the patient just a little bit. The patient is breathing out through the nose and turning his head from right to left, and he supports himself only on the tip of the toes. When we support the patient, it's important to provide them the exact support they need at that moment. If it's too little, there will be a stress reaction. If it's too much, I will lose the effect which would contribute to their development. Point 7 was experiencing buoyancy. If someone has a good breathing control, I usually start with this. I ask them to sit on the bottom of the pool and let's look at what happens. So the patient took a deep breath, then with alternating arm movements tried to press himself downwards, and it didn't work, and he realized that as well. It's an important moment in terms of trust, because our patients are afraid of sinking, etc. And it's perfectly reasonable, but if they realize that they are not able to sink actually under the water, they will have more trust later on. Let's look at rotation against the sagittal axis. You can see this rotation quite well, and the water will guide his body to the right, and when I ask him to take up a central position, it will be his own control, and there's a possibility of gradual development. It was nice exercise from the patient. This is the transversal axis from a sitting position. The patient takes up a position lying on the back. This position is quite difficult because you have no visual control, and the sensory motor function of the nervous system fixes everything due to our seeing, so it's more difficult. And rotation against the longitudinal axis, you can see this exercise now. We support the patient, and we change the position, and that's how we help them rotate. You can do this exercise without the patient putting their face in the water. This is a more developed execution of the exercise. You have to learn that so that you can feel safe in the water. When you have already practiced this exercise well, I give less support. I hold him only at the hip, and the patient executes a 360-degree rotation and along the longitudinal axis, and then a 180-degree rotation along the transversal plane, which requires a transversional rotational control. And this is the combined form. We start from a sitting position, sagittal rotation on the right, a longitudinal rotation lying on the back, and transversal rotation to take up a sitting position. If a patient can execute this exercise beautifully, like this patient with the right breathing control, they are water safe. And these patients will probably look for opportunities to go into water in their living environment. At the end of the therapy, we need to discuss whether they are water safe or not, otherwise it might be dangerous for them. And my last transparency, Dia mentioned our human kinesiology laboratory, where we are able to carry out the Romberg measurement. Standing position for half a minute with eyes open and with eyes closed. Spastic semiparetic patients' results can be seen here. I didn't mention that before this test was carried out, before and after an aquatherapy manipulation. So there was a difference of 86 points difference, and you can see the result. The patient had a more stable position. It's an objective measurement for the effect of Aquatherapy. So the first two columns are measurements with eye open, and the second two columns are measurements with eyes closed. It's important to have objective tools to prove the efficacy of therapies, but what makes us happy is for the patient to be able to learn complex series of movements which they will be able to use safely in their own life. Thank you very much.
Thank you very much. Any questions from the audience to the speaker?
Mennyiben hozható ekvivalenciába a függesztő rácson végzett torna és a
How equivalent is suspended exercise as compared to water-based exercise? Because people often say that the harness is basically being in water on dry land. Well, thank you for the question. Of course, I haven't been able to speak about psychological outcomes of this therapy. Well, water is your first experience in life ever, because in the uterus you are floating. So once this is such an ancient experience, uncomparable to anything else. It is the here and now, the hic-et-nunc feeling, sensation, experience. So I think the two are similar in terms of relieving the body, but the experience in water has a much different impact on the psychology of the person. I actually have training and certification in suspended harness therapy, but I would not create an analogy between suspension and water. Because on the one hand, the more things happen to a child, the better. Of course, you have to watch out for not overloading the child and making sure they can rest enough. Yeah, a harness could be useful for patients who need to be relieved if they are counterindicated, if they are not, if it is not recommended to use water hydrotherapy for them specifically. But other than that, water is always better.